It's rolling.
My cousin's 3-year-old came to her crying. I stubbed my toe, the boy wailed. Which one, mother asked. The one that went to the market, he sobbed. This is one of the many jokes used to help patients laugh and allow for humor to heal them. Nurses and doctors use this technique to help patients. They help them get through their work, and it also helps nurses and doctors get through their workday. I'll explain how humor affects patients emotionally, physically, psychologically, and when it is useful for patients to use humor in healing. If you are ever visiting someone you know who is sick in the hospital, you can try to make them laugh to make them get better. I have extensively researched this topic for this speech, but also for my own knowledge. Let's begin with how humor helps patients help with their emotional healing. The basis of the healing process relies on the patient's emotional state. If patients are emotionally unable to get past their diagnosis, they will be unable to heal properly. Humor is a universal emotion used to adapt to difficult or stressful situations. It is used as a way to adjust to their diagnosis and to cope with a possible outcome. Patients who are emotionally stable prefer using humor to keep positive. Patients say, "If I don't laugh, I'll cry." Doctors and nurses carry a large emotional burden by working with ill patients whose future can possibly lie in their hands. Using humor during their workday to deal with difficult situations or demanding patients keep them sane and emotionally stable. Nurses reported laughing with patients allow them to cope better with emotional distress. Emotional effects of humor are a big part of healing, but physical effects is where humor affects patients' health. Laughter is good for patients. It is like exercise. Laughter activates systems that are not normally activated through patients' everyday activities, such as patients' muscles activate, heart rate increases, and it stimulates endorphins, which are the body's natural pain relievers. Respiration increases, causing greater oxygen exchange. And another important aspect of humor in healing is the psychological effects, allowing patients to be able to heal themselves using the power of their mind. 3 parts relating to humor include spirituality, mental health, and relationship with others. Spirituality helps patients to continue to have faith. Humor gives them a reminder to not take everything too seriously. It helps patients find meaning and purpose in their lives. It increases mental health and allows patients to laugh with themselves. Humor also affects the way patients have internal dialogues with themselves. It makes them think. What patients think of themselves while they're trying to heal may often be negative, which by adding humor, it lessens feelings of stress and anxiety. Used to distract patients from what is really going on. It allows them to be happy and enjoy life. It is used to connect with others also. Nurses use humor to build trustworthy relationships and let them know they are there for them every step of the way. Now that I have discussed all positive aspects of humor in the healing process, it is important to mention how it can be used more efficiently in hospitals. Nurses and doctors may not only use humor to its full potential. They may feel it is unprofessional to be joking around, but it is an important coping method when used in moderation. It creates a more relaxed and calm atmosphere, and it increases the amount of cohesion between nurses and patients. Interacting humorously with patients can be a planned part of a routine or can be unexpected. In conclusion, humor heals in many ways, emotionally, physically, and psychologically. Studies have proven humor helps patients be in a better mood, relax, build trustworthy relationships, and provide exercise. Humor should be used more frequently in hospitals. It helps patients heal due to all of the positive effects. Next time you're in a hospital, don't hesitate to crack a joke or do something funny to make someone